Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist Dr. Rudraman, and today we are going to be talking about angular cheilitis. Let's start. So today we are going to be talking about angular cheilitis, a topic that is very common, a clinical finding or a disease that is actually seen very commonly amongst people for varied reasons. So let me tell you how the angular cheilitis looks like. It's basically a fissuring or basically an ulceration or the abrasion of the corner of your mouth or the lips, and it is usually accompanied by a lot of pain and maybe sometimes burning sensation. The most important thing while dealing with angular cheilitis is to finding out the cause of the disease itself. There are multiple reasons and multiple causes for the etiology of angular cheilitis, and we will be discussing them one by one. Angular cheilitis is usually seen as a salivary stasis. That means your drool or your saliva is basically accumulating at the corners of your mouth, making it a niche area for colonization by bacteria or maybe fungal infection causing organisms. At the same time, you need to understand that there are some sort of mechanical factors also involved with it, especially when it comes to old patients. When they have, if they are edentulous, that means they don't have any teeth, their corners of the mouth tend to droop, and that is why it leads to causing of salivary stasis, and therefore they become susceptible to angular cheilitis. Also in patients who are complete denture wearers but their vertical dimension has not been recorded properly, that means that the dimension of the dentures have not compensated for the loss of the bone of the jaws, might lead to drooping of the lips and thereby causing angular cheilitis. Now I would want to talk about also one more thing, that if the vertical dimension is more than enough, in the sense that it is excess, your lips can basically get stretched and the corners of the mouth can get ulcerated, which can lead to more susceptibility towards angular cheilitis. Coming to the other cause, yes, you can have angular cheilitis if you have, the most common cases that I've seen in my practice is because of any sort of malnutrition or a vitamin deficiency. Now what you need to understand is that it's very simple. If you know that you are deficient in something, we'll probably supplement you with that kind of a nutritive supplement, and make sure that we wait and watch and see how you are progressing, and within a couple of weeks or maybe a month you might get better with that. People who are undergoing orthodontic treatment, that means they are undergoing any sort of bracket and wire treatment, might have some allergic component. At the same time, there might be a chronic irritation factor while they're opening and closing their mouth while eating or any sort of functional activity, thereby causing that irritation and leading to angular cheilitis. People undergoing dental operations for a very long time, that means they're going for major surgeries, anything sort of implants or full mouth reconstruction, where they have to keep their mouth open for a very long time, it might lead to the stretching and the drying out of the corners of the mouth, and thereby they would get angular cheilitis. A very common complaint that we see when it comes to angular cheilitis is when you have xerostomia or dry mouth. This is especially seen in patients with Sjogren's syndrome, an autoimmune disease where basically your the secretory apparatus of your mouth and eyes is basically targeted, and you're not able to produce enough saliva or enough tears, and because of the lack of saliva and the drying of the corner of the mouth, you might get ulcerations and angular cheilitis. People undergoing radiation for head and neck cancers and oncosurgeries might get mucositis, because that's called radiation mucositis, and that leads to the susceptibility of the skin of the mucosa to become more irritable, at the same time more susceptible to break down, and therefore you can get angular cheilitis because of that. The treatment of angular cheilitis is very simple. You need to find the cause and treat it. If it's some sort of nutritional deficiency, treat it with that, be it vitamin supplementation, or when it comes to iron deficiency anemia, you treat it with basically your iron supplementation. When it comes to ill-fitting dentures, obviously your prosthodontic rehabilitation, that means your dentures need to be made much better when it comes to the fitting. Ill-fitting dentures need to be fixed with proper vertical dimension. At the same time, if you have people who are old and they don't want dentures, and if there is drooping of the corner of the mouth, you can go for derma fillers and all those things. But then again, the etiology is very simple, that just treat the cause and it will be fine. So this was today's episode about angular cheilitis. It was we can talk about it for a very long time, but at the same time, it's a very simple and a very common problem that is dealt with a lot of people, and it causes a lot of discomfort in the form of pain or even burning sensation. So what you need to understand is visit your dentist and get everything checked out as to what is the cause, treat the cause, and finally you can get better. So this was today's episode. Like, share and subscribe. Please press the bell icon for updates. And if you want to contact me, here are my handles and my contact number. Please do make sure that you message before call, because I might be with a patient or might be involved in some other work. So this was today's episode. Thank you.